I get a lot of women in my office who have sore nipples, low milk supply, or just really ongoing issues that they feel like they have tried everything and they've read all the books and they watched all the videos, when in reality, by the time they get into my office, we find that this baby has a tongue tie. Now, a tongue tie is when the frenulum underneath the tongue there is tight. And it means that the tongue isn't going to come forward enough in order to milk the breast. So the tongue flicks the nipple like this, and that's when you're going to get the breakdown. You can also have a baby with a tongue tie and not have some sore nipples, but yet they're not transferring well. Because again, if their tongue is only going like this, then we're not going to be able to milk the breast correctly. Those of you who have a lot of milk with a tongue tie baby, eventually, in most cases, it will catch up to you when your milk regulates, which is about 3 to 5 months. You will find that there's a drop in your supply when in reality it's just the body is now regulating. When that baby hadn't been on very well from the very beginning and it relied on your fast flow, eventually it will catch up. And when this baby gets older, sometimes it's harder to reteach a baby. Sometimes we can, sometimes we can't. So just keep that in mind. So let me explain a little bit about tongue ties and why this affects breastfeeding. I believe it is a big reason why people quit. I believe it's the main reason why people have ongoing nipple trauma. And I think it's about 50% of the time when women have a low milk supply, I would blame the tongue ties. Now there are 4 to 5 types of tongue tie. There's type 1, 2, 3, and 4. And then I think there's a 5th one, which I think is a little different characteristics than the type 4. But a lot of research will class those 2 types together. Now, a lot of women come to me and realize and want to know, why did my pediatrician not pick this up? Or if they did, why did they say that it wasn't going to be a big deal, but yet I've been suffering for 2 months with no skin on my nipples and they're bleeding and they're sore and I'm really at the point where I want to quit? Well, the number one reason is because we are a bottle feeding culture. They're not teaching the physicians about these tongue ties, and they're certainly not talking to them about the relationship between tongue ties and breastfeeding. Very rarely will occasionally, there's maybe once a month where I'll find a pediatrician who is on the ball and is understanding the damage that a tongue tie can do to a breastfeeding relationship. A lot of moms, women take responsibility. I should have done something different. I should have read a book, and I'm doing everything. I'm doing the right holds. Everyone says this latch looks great, and it goes on and on and on. But yet, constant soreness, and then moms feel that guilty, and they feel like something and shameful that they are doing wrong. I didn't even know that there were other tongue ties. I only knew about the classical ones, the ones that are at the very tip of the tongue, tied down to the bottom of the mouth. Those are the obvious ones, and usually the tongue goes up like this because it's tied. Anytime you see a heart shape, when these babies cry, you'll have a heart-shaped tongue. Sometimes we'll see that, not in every case, but we would. That's one characteristic. And then there's the type 2, which means it's just a little bit back further from the tip of the tongue to the bottom, tied to the bottom of the mouth. You will see a very distinctive, not in every case, and sometimes I actually have to find the type 2s, but type 1s are, again, across the board, very obvious. And what they do is when we have a type 1 or 2, we send you back to your pediatrician to clip. It doesn't hurt the baby. There's not even a recovery period. So it's really important to address this, because if we don't address this now, we're going to have to eventually address it later on anyway, for the most part. Sometimes the gum will recede back because of that tie pulls back the bottom gum. And so therefore this baby, or when this child grows up and goes to the dentist, they're going to have to do a little bit more dental work and have to do it then. I assure you it does not hurt them at all. And I don't mean that to discount anybody's concerns about that. It literally, there's no nerve endings in the type 1s and 2s. And that's when, so again, no blood, no pain, and they lift up the tongue. The pediatrician, again, is trained, most pediatricians are trained in order to know how to release the tongue. And so what also that we're not paying attention to, and even in my field, there's not a lot of colleagues of mine that are even aware of type 3 and 4s and 5s. I went to one of the longest lactation trainings in the United States, and they didn't cover the posterior tongue ties. I remember talking about tongue ties because it was the very last class. And when I would have people come into my clinics, when I worked in a hospital-based breastfeeding clinics, I worked in several of them, about 3, and people would come in to the office months out, 2-3 months into the clinic, and their nipples will be gone. And I didn't understand how women can have this ongoing nipple pain when the latch looks good. Well, I went to an area legal allegedly conference, which is this big conference brought together by some famous, I call them famous, but people that are high up in the lactation field who are doing the studies and the research and the education. And some ladies started talking about these posterior tongue ties and the reason for low milk supply, reason for ongoing sore nipples. And bingo, I was introduced to the posterior tongue ties. Catherine Watson-Jenna is the one who is our person in our field who does the research and the studies and has written several books on supporting sucking skills that are for lactation consultants and medical providers to read and learn more about. So the good news is that there are solutions. Usually the type 3s we send out to an ENT, ears, nose, and throat doctor, and the 4s, and again, 4.5, 5s, which is, the 5 is usually called a submucosal tongue tie. The ones further back, again, 3s, you usually still see that white strip underneath the tongue, but it's just further back. And then with the type 4s or posterior, you sometimes just see a white line. And we're going to be looking for the heart shape when they cry. Maybe the tongue comes up this way. The tongue doesn't stay extended past the gum line. That's also a tongue tie. It's like a rubber band. And it will go past the gum line and it'll go right back. And if that tongue doesn't stay there past the gum line, these babies instinctively bite. And they bite the nipples, which again is going to cause sore nipples and may cause the low milk supply. So type 5 is a submucosal. And submucosal means that underneath the tongue, you don't see that white line too much. You just see, it's almost like a blob of mucus. And I've seen that, where it's very smooth underneath the tongue. But again, you see a little bit of a heart shape, or you see these babies unable to bring their tongue forward past the gum line. So what we do with 3s, again, it is a local anesthetic at that point. Anybody who wants to put your baby under general anesthesia for this, especially the 1, 2s, 3s, and 4s, I would keep finding someone who will not put your baby under. That's absolutely not what research is supporting these days. And it's a procedure that is very easy. It is done, again, it's a local anesthetic for the 3s and the 4s and the 5s. So with 3s, again, usually ENTs can take care of it. And with the 4s, again, ENTs can take care of it as well, or an oral surgeon who is familiar with the tongue ties and the relationship with breastfeeding. And there are also some dentists out there who are able to help you as well with any degree of tongue ties. Some dentists are doing laser, and then again, others are just doing the local and then cutting. Either way, it's a cut. So when it comes to a local anesthetic, that's all they get, and it does bleed. Usually the 4th degrees and the 5s are going to bleed, and they'll bleed for about a minute. And then if you have a breastfeeding friendly doctor, we would want you to breastfeed right afterwards and make sure everything's okay. I see a lot of success with this, and I see a lot of results, and I see a lot of moms who are breastfeeding get that relationship can continue when we release the tongue. It's also inherited. So one of you on mom or dad's side has brought this to, again, it's genetics, and chances are you have a great shot at one of your other kids having a tongue tie, but it will be, usually they're different degrees. So one thing that we want to make sure is having you go and research and let this be your decision. So we can go to American Academy of Pediatrics. So go to www.aap.org. Then you're going to put in the search tongue tie and then click. And the first thing that pops up, it will look like it's not an article, but it is a 4-page description in great detail about these types and what we need to do with these tongue ties and how they impact breastfeeding. Again, that is written by Catherine Watson-Jenna and some of her medical colleagues for American Academy of Pediatrics. There is anything by Dr. Lawrence Cutlow, who is also a dentist. He's either a dentist or an oral surgeon, so I apologize for not knowing which one it is. He has some great PowerPoint presentations out there. He is also going and educating other medical professionals about these tongue ties and the relationship that it has with breastfeeding. Dr. Brian Palmer, who is a dentist, or was, he passed away a couple years ago, and his legacy was teaching also his colleagues and other professionals working with breastfeeding women about the effects of tongue tie on breastfeeding. It is a huge reason why women fail. It's a huge reason why you still have sore nipples. We can give you all kinds of positions. We can spend hours on positioning. If it's really a tongue tie getting in the way, it's usually such an easy fix. And again, they usually will come up to haunt you. Research says that they all need to be addressed. They all need to be taken care of because they can have speech issues, they can have feeding issues, they can have latching issues throughout the whole entire experience. And then, even in Dr. Cutlow's experience and what he educates others on, is that there can be some apnea issues as well. And I hate to even throw that out there, but that's in research. And that's why we do need to realize that we need to address these and get the right person to address them. The other thing is, a lot of people feel like their baby has reflux. And in reality, they have a tongue tie because his tongue isn't scooping up and swallowing correctly. It's just doing this. They'll usually be messy and milk coming out of the sides of the mouth. Sometimes they can't latch on. They use their gums, or again, a very weak suck, just because again, they haven't gotten that strength from a tongue that's able to go forward. Sometimes people will say, oh my gosh, my baby does nurse, and they nurse hard. That's also a red flag. And also another thing to consider is when they have a tongue tie, they can very well have a lip tie. And a lip tie is where you're going to look at where that frenulum, that top frenulum is to the gum. If it's to the gum line and making a separation, it's possibly a tongue tie that needs to be addressed. Sometimes I get tongue ties that are so tight, I can't move the lip past here. And we would want the lips way up there, as you see my nice gums. And so we want that lip up high, but some babies, again, can barely move it. Or those moms that keep pushing the lip up and it goes right back down. That could also be a lip tie. When we have a lip tie, we automatically have a tongue tie of some sort. And so we can also have a tongue tie without a lip tie. And typically also there's a higher palate there. And we look at everything in general. So again, it's really important to find a lactation professional that understands this so they can help you, so you can breastfeed successfully, get the right support, get healing for your sore nipples, get healing for, get the right stimulation for your breast, and go on to enjoy breastfeeding the way it's intended. Certainly, if you have any other questions, please don't hesitate to call or send me an email and let me know how I can further serve you in this topic that again is not 100% understood. So there's hope out there.